Season 1 is done, and I want to take a moment before we begin season 2 to say thank you. Thank you so much. For over 12 episodes, we covered transplant medicine, we covered diabetes, we covered mental health, we covered heart disease, holistic medicine, GLP-1 medication, cancer care, and more. We sat with pharmacists, surgeons, dietitians, and specialists who gave their most important clinical knowledge, not for their colleagues only, but for you, the patient, the parent, the person standing at the pharmacy counter, wondering why their medication is not working the way it should. And in our episodes of season 1, we did something that surprised even me. We talked about children, about the fact that kids are not being prescribed adult medications, about childhood obesity, about what happens when a growing body meets a prescription that was designed for a 60-year-old. And that conversation opened a door. So welcome to season 2 of When Food Meets Medicine. I am your host, Dr. Remi Olukoya. I'm a pharmacist, a patient advocate, and the person who spent the last 12 episodes asking one question is that many ways as I can. How does what you eat change how your medication works? So season 1 gave us the foundation. We covered adults, their conditions, their prescriptions, their diets, and the interactions that most of them were never warned about. But season 2 is going to go deeper. We're going to talk about children, about the brain, about inflammation, about mental health and medication, about the communities that are most underserved, underdeserved by the current healthcare conversation. And we're starting where the most important habits are formed in childhood. So before we start, I would like to say this clearly. Everything on this show is for educational purposes only. It does not replace your doctor or pharmacist or dietitian. Always consult your care team before making any changes. And if this conversation is useful to you, please subscribe. It's the single best way to support the show and make sure you never miss an episode. My guest today is Dr. Miriam Yusuf Ogome. She's a consultant pediatrician, a nutrition specialist, and someone who believes, as I do, that the conversation between food and medicine has to begin long before a child ever needs a prescription. Welcome to When Food Meets Medicine, the podcast dedicated to empowering you with knowledge about what you eat, interact with your medication. I'm your host, Dr. Remi Olukoya, and I'm thrilled you're joining us today. We often focus on adult medication safety, but what about our most precious vulnerable population, our children? It's a question that keeps many parents up at night, wondering if the medication their child is taking is truly working effectively, or if that glass of milk or juice could be diminishing its power. So imagine a scenario. A child with a recurring hair infection is prescribed amoxicillin, and the parents diligently administer the antibiotic, but perhaps they don't realize that administering it with a highly acidic fruit juice like orange juice might, in some rare cases, slightly reduce its absorption, potentially impacting its effectiveness over time. Or consider a child on a seizure medication like phenytoin, where sudden drastic changes in dietary protein intake could subtly alter its metabolism and blood levels, leading to either toxicity or loss of seizure control. So these are not just theoretical concerns. There are real-world challenges that healthcare professionals and parents face every single day. The stakes are incredibly high when it comes to pediatric health, and understanding this intricate relationship between food and medicine becomes absolutely important and critical. So today we have an exceptionally insightful guest who is at the forefront of pediatric care. She's not just a brilliant clinician, but a visionary leader. She's passionate about holistic well-being and systemic improvement in healthcare. So I'm absolutely delighted to introduce Dr. Miriam Yusuf Ogome, a distinguished consultant pediatrician. Dr. Miriam holds a postgraduate certificate in pediatric nutrition from Boston University and University of California. She's currently training in functional medicine and is pursuing an executive MBA at the Lagos Business School, all while exploring the exciting frontiers of artificial intelligence in pediatrics. Dr. Miriam, welcome to When Food Meets Medicine.
Thank you very much, Dr. Remi. It's a pleasure to be here. Thank you for the opportunity.
It's an honor to have you. So before we dive into the fascinating world of pediatric food-drug interactions, Can you please share a little about your journey and what led to you specializing in pediatrics and more broadly, how to advocate for holistic and patient centered care for children?
Thank you very much. When I finished my undergrad and I was thinking of what to specialize in, it was basically by elimination that I picked pediatrics. But more
Mm,
importantly, I love I love the fact that children don't pretend. When a child is
true.
sick, you know. When a child is
Mm,
well, you know. That
mm,
is one of the things I love the most about pediatrics. I also like the fact that children are very peculiar. They are vulnerable, so they need advocates. I am a child
mm,
advocate, and that's because
mm.
we understand the vulnerability of children. They cannot really speak for themselves. So they
True.
need people
True.
that are passionate about them, understand them, and are willing to speak up for them where it matters. So that's how
Yeah.
I found myself in pediatrics. And I'm
No,
passionate about pediatric nutrition because I believe that you are what you eat and that the
true.
basis for good health is good nutrition. When you eat well, the tendency to fall sick is minimal.
Very correct.
A diet determines to a large extent the cost of our health. So I decided to also pick pediatric nutrition up and then add a functional medicine field to it, which is the medicine of root cause analysis, understanding that sickness is a holistic thing. You don't just pick
Yeah.
sickness in isolation. There are other things that
True.
affect the outcome of a person vis-a-vis what they eat, their lifestyle, their genes, um, and other things they do. So I
Mm,
believe that getting to the root of the illness, not only for long term health, but also for prevention.
mm.
Thank you.
Makes sense. Yeah. Thank you, Dr. Miriam. Your dedication to comprehensive pediatric care truly shines through. So the unique challenges of pediatric medication and nutrition, Dr. Miriam, children are not just small adults. Their physiology is distinct, making medication dosing and metabolism incredibly complex. So from a pediatrician's perspective, what are some of the most challenges you encounter when prescribing and managing medications for your young patients?
So, some of the challenges we encounter is the fact that we don't have a lot of research carried out in
Mm,
children. Most
mm,
research on metabolism, on drug metabolism, is carried out on adults. And
true.
then you see people replicating these things, and then taking whatever the outcome is and then directly fitting it into the treatment of children. And you will
Mm,
agree with me that children are not small adults. Their
yeah.
physiology, their biochemistry, their anatomy is
Yeah.
quite different from that of adults and is peculiar
Mm,
in its own way. So that is a major constraint, a major limitation. But still, we still have a few studies being carried out in children, and those are enough to let us know that there's a peculiarity of the interaction of food and
mm,
medicine in children. What,
yeah.
when, and how a child eats can make a medicine work better, worse, or not at all. So
True.
these are things that we have in mind when we're treating children. We also
Mm,
ensure that we take a detailed drug history
yeah.
because oftentimes patients do not tell you, sometimes because they don't know,
Yeah.
sometimes because
Yeah.
they think it doesn't really make a difference, or they just tell
Yeah.
you if the drug is not an antibiotic, or the child is taking some supplement, or the child is taking some herbal medicine, they probably will not tell you except you ask and probe further. So these are the things that we
Mm.
consider when we're managing children and thinking of how food and medicine work together.
Very, very crucial point because we have different developmental differences. For instance, an infant's liver and kidney functions are immature, meaning that they metabolize, excrete drugs differently than an older child or adult. And this can lead to drugs staying in their system longer or reaching higher concentrations, which increases adverse effects. An example is interaction between tetracycline, an antibiotic, and calcium-rich foods like milk or yogurt. It's well known in adults when calcium binds with antibiotic, it reduces the absorption of it by at least 50%. So when parents are giving their child milk with tetracycline, they could be making the medication less effective. So What strategies do you employ to educate parents to make sure that, there's optimal medical effectiveness while still meeting a child's nutritional requirements?
So basically, pediatricians do a lot of talking. Yeah, we do a lot of talking. So after asking those questions, we still go a step ahead to reinforce what they need to do. Things like telling them that you do not give a child a medication with a tablespoon or a teaspoon. Measure with a dosing syringe, never a kitchen spoon. We also let them know, okay, if your child is on this medication,
Uh,
you have to let the patient understand what you're saying and be sure that the patient
mm,
understands what you're saying. Things like,
mhm,
oh, don't give your child a medication with a tablespoon or a teaspoon. Make sure you use
mm,
a dosing syringe. Things
mm,
like milk and calcium, can interact with drugs like iron. So for
mm,
babies that are being breastfed or formula fed, for instance, we say separate the
mm,
feeding 2 hours. 2 hours after taking formula is when you give the iron. The child is taking calcium and iron, for instance, especially in our preterm babies that we send home with iron supplements and calcium. We say you can put one during the morning and the other one at night. So these are some of the things we tell them. If a child is taking iron, we also have to add vitamin C because we know that
mm,
it boosts the absorption of iron. If a
mm,
child is eating grapefruits, then it can interact with immune suppressing drugs. So these are
mm,
some of the things. And that's why a detailed drug history and allergy history is very, very important. Also, pediatricians go ahead and take a nutritional history. What is this child eating? What is this child dietary 24-hour, 48-hour dietary recall like? What is this
yeah.
child diet like? So we do all these things just to pinpoint, you know, areas where we can run into issues and go ahead to inform the patient and educate them on how their foods can interact with their drugs and how
Mm,
appropriate timely dosing is very,
mm,
very important and can determine the absorption, and bioavailability of the drug to the child.
yeah.
You can have something as much as sometimes the child is on ACT, artesunate combination therapy. Maybe the child has malaria, and something as simple as giving a fatty meal before administering that drug can determine how much of the drug the child absorbs. So these are things that you know, we go ahead and inform them about after taking a detailed nutritional and a detailed drug history.
Can you give me like two example of a fatty meal? Because the parent may be hearing this and have no idea what they're giving their child is a fatty meal.
Okay, so something like a yogurt, then like toast, wheat toast and butter. Sometimes the child is throwing up and can't really tolerate anything. So
Mm,
you just give something like maybe toast and butter on top of it, or avocado
mm,
pear,
mm,
or any food in Nigerian palace, say, or stew that is oily, fatty, you
yeah.
give it with some potatoes and make sure you give that. And sometimes you just want to give the child a treat. It may just even be ice cream, but something fatty, yeah, just to help and aid the absorption.
eh, of the food. I know we'd mentioned earlier about kids' physiology compared to adults, and we know they're not miniature adults. So this obviously becomes very clear when we look at specific medication classes. Are there particular types of medication or common pediatric condition where you frequently see or you anticipate food drug interactions? I'll give instances with conditions like asthma, epilepsy, or even common infections. Are there specific dietary conditions parents should be aware of, like red flags?
Okay, so for some children, particularly children with ADHD, what we call attention deficit hyperactive disorders, a lot of them are not aware that caffeine can worsen the hyperactivity. So
Mm,
sometimes you have a scenario where the mother just thinks she's giving Coke, something as simple as Coke, or
mm,
something as little as chocolate,
mm,
and she just sees that this child is just hyperactive, is unable to sleep you
mm,
know, and then coming to the hospital, you realize after taking a history, a nutritional history, what exactly did you notice that this child often eats and gets more hyperactive? And then
mm,
you see her saying, "Oh, I remember, I think I've been giving this child, a lot of
mm,
coke and all that." And sometimes these drugs also, probably we have some preparations of paracetamol that have caffeine in them.
Yeah.
For a child that has a ADHD, and you give that child, you see that this child moves from not just having headaches, but the child is also now unable to sleep, which then goes
Mm,
around in a cycle and worsens this headache that you're trying to treat the
mm,
child with. So
mm,
these are some of the interaction we see. Sometimes you see it with seizure, anti-seizure medications, anti-epileptic medications. You see that these children are coming down with vitamin D deficiency because carbamazepine can deplete vitamin D. And sometimes that's why when these children, also same thing for vitamin D, that happens a lot in carbamazepine, you have a depletion of vitamin D. So we go ahead to make sure that when we're placing these children on these anticonvulsants, we also place them on vitamin B and vitamin D as well, just to
mm.
make sure that their body works optimally, because some of these vitamins are essential for enzymatic function and can determine the overall bioavailability of the drug, depending on
Yeah.
whether those enzymes are deficient or sufficient in the body.
Okay. Incredibly insightful. Thank you, Dr. Miriam. The interaction between certain antibiotics and food, I know are classic examples. I'll talk about ciprofloxacin, an antibiotic sometimes used in children for specific resistance infection. And its absorption can be significantly reduced by dairy products, milk, or juices that they put calcium in it, sometimes as much as 30 to 50%. I know this can compromise treatment of severe infection, and the advice is usually to separate administration. I think you had mentioned it earlier, by at least 2 hours. What's your approach to explaining those complexities to parents in a way that they understand it, especially when dealing with chronic conditions that they have to treat for a long time?
So this is a two-pronged approach.
Yeah.
Sometimes you explain this to the patients, but they don't seem to understand what you're saying until they
Mm,
come back to the clinic and tell you that, oh, this child's seizure control is not good. This
mm,
child's infection, I don't know what's going on. The child is still running a fever. And then
mm,
you trace back and you ask, what I told you, did you observe it? And the woman says, actually, I didn't. I didn't know it will make much of a difference. So
mm,
they end up being the ones teaching themselves. They now
mm,
see, oh, the importance of what you were saying in retrospect. And some, when you give them that information, they
yeah.
actually go ahead to follow it. And they see that these children, overall outcome, is better. Some of them at some point, you even end up winning them off those drugs because the children have done so well on it. So
Mm.
these are some of the peculiarities we see in children. Just like I said, children are vulnerable, and sometimes, they just need a voice to speak up for them.
It's quite important for parents to listen to their kids' doctors so that they don't have to keep treating the same infection, because sometimes it gets worse over time, or you have to use more expensive medications when what was cheaper, the antibiotic that was cheaper, doesn't work anymore. You have to use something more expensive. So your background in pediatric nutrition and training in functional medicine, it truly does set you apart. So how did this specialized area influence your approach to medication management and food drug interactions in children?
Thank you. So basically, functional medicine is a root cause approach to wellness or sickness. Basically, it's making sure that the body is in an optimal state, to prevent illness, and peradventure, if there is illness, to restore the body back to its natural, normal, so that it does not come down with any illness. And that is one thing I love about functional medicine, especially for children, because children, that metabolism is often optimal, and it's a two-pronged thing. So because of
Yeah.
that, sometimes you see parents taking it for granted because their metabolism is optimal, but they do not understand that chronic illnesses that come in later life can be traced to childhood. For
Mm,
instance, if a child has been battling insulin resistance from a young age, when a child grows up and comes down with type 2 diabetes mellitus, you think
mm,
that is when it surfaced. That's not when it surfaced. It surfaced when that child was having a lot of processed foods, was not getting enough exercise, did not have a good gut health and all that. So
mm,
most diseases that show up later in adulthood can be traced back to childhood. So that is when
mm,
you actually have the best opportunity to determine to a large extent the cost of
mm,
a child's life. It's like
mm,
saving ahead. for the child. It's like buying
That's
the
wow.
child's life ahead for the child.
I
So
love
when you keep
yeah.
the child in optimum health,
Yeah.
and if peradventure the child has any condition they're dealing with, for instance, children that have autism, studies have shown that there's something called the gut-brain axis. There's a direct relationship between the gut health of a child and the brain health of the child, the cognition,
Mm,
the learning, the social interaction of the child. And so you see that when the gut health is restored, you see the symptoms of the autism getting better. You see the child's social interaction getting better. You see the child's relationship with his peers getting better.
mm,
Also, I must mention exclusive breastfeeding. Breast milk is a major, major determinant of the
mm,
future health of the child. There are so
mm,
many diseases that can be prevented just by making sure that the child is exclusively breastfed. Things like hypertension, things like
right.
diabetes, things like obesity, even some cancers can be
Mm,
prevented in children. Allergic conditions, asthma, bronchopneumonia
mm,
can be prevented in children just by exclusively breastfeeding them. So
wow.
the body, God has already provided a natural way in which we can keep ourselves healthy. But
Yeah.
sometimes, for reasons best known to us, we just determine want to take a cheaper and easier alternative. There's some of consequences for some of these things. So
Mm,
we find that optimizing a child's health from when a
mm,
child is young goes a long way to determine the cost of that child's health. And the good thing about children also is that children often adapt to what they are taught.
mm,
So if from early a child has been trained to eat healthy, to pick the right food choices, the child often grows up that way and gets used to
yeah.
it. For instance, I have a lot of parents that come to us, their children are picky eaters. They don't eat fruits, they don't eat vegetables. And I always ask the same question, and I almost always get the same answer. Daddy, do you eat fruits and vegetables? The mom
Mm.
says, oh, no, I'm not really into it. I say, oh, so how
He
is the
sees
child going to
that the
pick it
kid
up?
sees that. The
The
kid
mom,
sees
the
that.
mom, no, the mom, you ask the mom, that, okay, your child doesn't eat fruits and vegetables. Do you eat fruits and vegetables?
Mm,
And the mom says, oh, no, we're not really into it. I don't really. I said, oh, so how is the child going to pick it up? From my own experience, being a mother of three as well, I've realized that children pick up the habits of their parents.
mm,
And so I have children that eat cucumber, carrots. I mean, there's absolutely no fruit or vegetable they can't eat because that's what they
mm.
saw us.
Yeah.
you know. So,
Yeah.
so,
Yeah.
so it's important for us to understand that there is a relationship between our guts and our brain health.
Mm,
There is a relationship between our lifestyle and our quality of life. And what functional and personalized nutrition does is that it comes with a root cause lens approach, asking why a symptom keeps coming back, not just the conventional medicine that suppresses it. A child comes with constipation. You just give the child a laxative. No. Why is the child coming with constipation? What about the child's diet? What about the child's
mm,
water intake? What about the child's
mm.
lifestyle? It's predisposing that child to constipation.
Yeah. Yeah.
You
Quite
know,
quite important. Yeah.
Yes, the child comes with an allergy condition. Do you have mold in the house? Was this child
Mm,
exclusively breastfed? These are root
mm.
cause analysis of problems that help
Yeah.
you to get to the bottom of it, not only address that problem at that point in time, but prevent it from occurring at another time.
Again. Yeah.
And if
Yeah.
you cannot minimizing the overall effect, on the quality of life of that child.
Very, very powerful perspectives on a lot of front. Got micro, so you beat me to it. But the idea, which food is medicine, which goes to your breast milk advice for parents, isn't just a cliche. That food can be medicine. It's a fundamental principle, especially in growing children, optimizing gut health. We can do that through prebiotics, probiotics, and they can influence gut microbiome, which in turn affects drug metabolism. From what you said, gut microbiome plays a significant role also in metabolizing drugs. I know for digoxin, sometimes naproxen, and an unhealthy gut could potentially lead to altered drug efficacy or increased side effects. Furthermore, nutrient deficiencies can, make situations worse, even side effects worse. So how do they put in those dietary assessments into the counseling, into your busy practice that you can give to parents so they can help their child's diet?
So basically, I have a simple rule. Keep foods natural, keep foods colorful.
Hmm.
Eat the rainbow, keep foods natural. I tell my
Yeah.
patients, anything that grows from the ground is always your best option.
Mm. Mm.
Pick
Mm.
fresh Irish potatoes over the store-bought, frozen, processed French fries. Things as simple as that. Things as simple as you can make your own cocoa banana ice cream at home.
Yeah.
I do
Yeah.
that a lot. I just blend my
Yeah.
frozen bananas with raw cocoa, and the children love it. And you'll be amazed. These children love these things. You want to make some
Yeah.
pancakes instead of me using gluten flour. I just go to blend my oats,
Healthy,
add my,
very healthy options.
no,
Yeah.
I just swap it here and there. It doesn't have to be boring.
Yeah.
It doesn't have to be
Yes.
boring.
Kids don't
Yeah.
like
I
boring.
tell my
And kids like color.
They don't like boring and they love color. I tell my patients oftentimes when they want to start winning, they want to buy all the expensive foods, they want to buy all the canned foods. I tell them, keep it simple. You have,
Mm.
we have our native pap in this place,
Yeah.
fermented, it's like a fermented corn grower.
Con.
I tell them, when you blend it, don't sieve it. That's fiber for the
Mm.
baby.
Mm.
And just like you, I started out sieving it. You won't believe it. It was my
Mm.
nanny that said, why not just try this? Don't sieve it. And I noticed that the child didn't even know the difference between when it was
Mm.
sieved and when it was not.
I mean, it wasn't.
The child never had constipation. And this was her winning meal. And then when it was time
Mm.
to take a semi-solid, there was amala, there was ewedu.
Mm-hmm.
These are like some muscle foods we have in this part of the world,
Yeah.
and ewedu is called jute leaf. They love it, and it's rich in iron, in folates, in B12, and a lot of
Yeah.
vitamins, vitamin K. So these are some of the simple choices. And then again, it doesn't have to be expensive to be good.
I picked up three to four. One is keep it simple, make it colorful, so the kids want to, want to do it. So, and I think it's also an effective way for parents that feel overwhelmed by so much information. And keep it simple. Also, it doesn't have to be expensive. Experiment with things at home. Keep it natural. Take things from the ground. If I'm getting you correctly, things grown from the ground are better. So, what specific food would you advise parents to avoid? Particular medication or drug classes that they should avoid? The foods to avoid in this instances.
Grapefruit will be one of note. Grapefruit interacts with a lot of medications, So if your child is on antibiotics, if your child is on seizure medications, it can affect the availability of that drug to
Mm.
the body. So I'll say
Yeah.
stay away from that. Also, if a child is taking iron supplements, I would say stay away from milk at that time or separate it by 2 hours. If it's a baby that is on formula or breast milk and that's their primary meal,
Yeah.
I would say keep it away. You know, if that's what the baby is eating, then just make sure you separate it by 2 hours. Also,
Yeah.
antacids. Antacids
Mm.
interact with calcium and magnesium. And sometimes
Mm.
some of these children with ADHD and autism, we place them on calcium, magnesium, sometimes zinc, and these interact.
Mm.
They interact with milk. So these are
Mm.
some of the things that we need to look at when talking
Yeah.
about drug interactions in children. And also be
Yeah.
careful with herbal supplements. Be very
Mm.
careful with herbal supplements. Some of them interact with the drugs, orthodox drugs that are prescribed in a way that even the physician may not be aware of because
Mm.
there's no end to some of these herbal supplements. So it's
Yeah.
better if you're taking any drug and you're not sure of the interaction, better stay away from that at that point in time. And
Yeah.
most importantly, make sure you talk to your doctor about any supplements, any
Yeah.
herbs that you
Yeah.
want to give your child. If they do not know, they will find out and they will get back to you.
Correct. I want to
Thank
elaborate on that, making sure all information is shared with your doctors and your pharmacists, because if there's any
you.
interaction, they can catch it before you give it to your child. I also want to make a point on the importance of reading medication labels. It cannot be overstated because, for example, you get an OTC, over the counter cough and cold medication, a drug called dextromethorphan, and grapefruit juice interacts with it. So if you take those, your kid may be having a higher level of the medication than you wanted. You're giving 5 ml, it stays in the body's and the levels are higher, the side effects are potentially increased also. So you see drowsiness, and the drowsiness is extending longer than it should because this medication sometimes makes you sleepy. So
Mm,
I do want to implore parents to make sure that every medication that your child is taking, very important that you let the doctor know or your pharmacist know before they prescribe you something else. And the foods the kids are taking too. It doesn't matter sometimes if it's small. You had mentioned earlier the fatty food, and that parents have to be careful in giving some of these medications or with this food, or giving medications over the counter that you think it's just over the counter is no big deal, that could interact with medications that the doctor is giving your kids. So, what resources or tools would you recommend to parents who want to stay informed about potential food drug interactions for their child's specific medication?
Thank you very much. So this is an opportunity for me to mention the book, Foods That Clash with Prescription. And I must tell you that those kind of books are not common. In fact, I haven't
Yeah.
seen any book addressing such an important concern,
Mm,
such an ongoing concern about how foods interact with medicine, things that are
mm,
often overlooked and
mm,
underemphasized. So,
mm,
this is to let you know that book is available, and it will be necessary for parents to get it because children are vulnerable. Children, at one point or the other, will need to visit the doctor and will need to use the
hmm.
medication. And
Yeah, true.
these ones cannot speak for themselves. They can't do that research themselves. They can't read up that for themselves. The ones
Yeah,
that are going to do that for them. And you cannot give what you do not have. So parents need
true.
to learn to be informed and correctly and rightfully so. Thank you.
Thank you, Dr. Gome, for that. And the book is
Make sure,
available. Go ahead.
yeah, always make sure that you ask your pharmacist important questions. When they say
Mm,
take this medication 2 times or 3 times a day. Ask, with or without food,
correct.
before or after food. Make sure you always ask that question because sometimes they can be overwhelmed and forget to mention. And you'll be amazed at how well a drug can work or how well it cannot work just because you have eaten or have not eaten.
It's important. So, so important. And thank you for stating that. For the book, it's available on pharmaplansystems.com. Like Dr. Miriam mentioned, it's important because people don't put emphasis on food and drug interaction. So, beyond your clinical expertise, your pursuit of executive MBA, your interest in artificial intelligence in healthcare, they're truly, truly inspiring. How do you see AI impacting medication safety, the management of food drug interactions in pediatric care?
So I must say that AI is a very useful tool. It's a very good support tool that helps with personalized nutrition. Now also going into what we call precision medicine. That's
Mm,
medicine that is tailored to fit individuals and
mm,
not just a general population of people, because we know that body differs.
mm,
Oftentimes these things are just taken in a straitjacket manner. But when you have precision medicine that tailors to fit therapy, tailors to fit diagnosis, tailors to fit diagnostic outcome, to individuals, targeted,
mm.
individualized
Yeah,
therapies. You know,
yeah.
these are things that are on the horizon that, you know, AI is there to help us with. Also,
Mm,
it helps with safer dosing. It helps the
mm,
clinician. It helps with decision support. And this also helps those in lower resource settings
yeah,
to have a
yeah.
higher, better access, to the kind of care that they ordinarily may not have access to. There's no limits
Mm.
to what, AI can assist us when there's
Yeah.
appropriate collaboration, and also understanding the limits that AI has when it comes to clinical care, when it comes to healthcare, understanding the limits he has and understanding that this is work in progress and something that will keep evolving. Thank you.
Yeah, it's quite important. Also, a fascinating vision in terms of how to use apps to better manage conditions and also a helpful tool for clinicians. Which brings me to MediMeal Safe app. It's an app that a parent can use to check if your kids' food interacts with their medications. And it's also available on pharmaplansystems.com. It's like a pharmacist in your pocket. So Dr. Miriam, you do speak passionately about providing an unforgettable physician experience where families feel heard, they feel supported, and confident in the care their children receive. So, in light of medication management and discussing sensitive topics like food drug interactions, how do you cultivate this experience? How do you communicate that to approaches you employ to empower parents to alleviate the anxiety, to make them feel like active partners in their children's care, especially when you're discussing medical and dietary information?
Thank you. The first thing is to make sure that the parents understand that they are heard and they are seen and that their concerns are valid. When you start with that, in the forefront, it's easy to gain their trust when they understand that their concerns are valid. The things that they are saying, you understand, you hear them, and their concerns are important to you as well. And then taking it from there, you let them know that children are not small adults. We've said that over and over again. And what applies to you as an adult does not necessarily apply to them. And also letting them understand that drugs interact with food. And this has been proven with research. Therefore, if we are both concerned about getting a child well, or getting a child healthy, we need to pay attention to these things. We need to do it the way it should be done so that we can get the kind of desired results. And so when you come from this perspective and they understand that what you are telling them is for the good of their children, they will listen. And if you've been able to gain their trust, they can always ask you questions, and you put an atmosphere where you allow them to ask questions and you reiterate to be sure that both of you are on the same level, speaking the same language, and have a common goal, and
Yeah.
have mapped out how to arrive at that common goal, which is the health of their child.
Yeah.
As the healthcare provider and as the parents, the goal is the same: to get the child well, to get the child alive, to get the child healthy. So when you get them
Yeah.
to see it from that perspective, it's easier for them to listen to you.
Yeah, beautifully put. Empathy, clear communication, it's quite important. And it's also about just conveying facts, building trust, and the emphasis on families being heard. Parents feel confident in their understanding and their role in being in their child's health journey. So, Dr. Fumi, we're going to go to a section where we ask questions. It's called a rapid fire. I ask questions and you have to answer what comes to your mind first. Are you ready?
Okay.
Are you ready? Okay. So the
Ready?
first question is, what's one common healthy food you wish parents knew and that could sometimes interfere with medication?
I would say sweet potatoes, healthy food,
Okay. Yeah.
commonly interacting, milk.
Milk. Yes. Okay. If you could give every new parent one piece of advice about their child's medication, what would it be?
If it's not necessary, then you don't need to use it.
Okay.
Yeah, because
Beyond
drugs have
fun.
side effects.
Yes. No, true, true. Keep it simple. Beyond functional medicine, what's a wellness trend for children that you're watching closely, either with caution or excitement?
One thing I'm watching closely is the adverse effect of increased screen time on
Mm-hmm.
neurodevelopmental outcomes in children.
Mm,
Recently, we have seen an increasing trend of autism,
mm,
ADHD, and
mm,
clinicians are wondering all over the world what is going on. We're
mm,
watching
mm,
closely, we're paying attention. What is
mm.
going on? Is it our diet? Is it our environment? What is going on? Is it increased diagnosis? Is it
Mm,
increased awareness? But one
mm,
thing that we have seen that is implicated is excessive screen time.
mm,
Excessive screen time. So
mm.
this is something I'm paying close attention to in the functional medicine space and even also in the pediatric space as well. We're looking at
Okay.
studies to tell us what exactly is going on. Why do we have such a high incidence of neurodevelopmental disorders in children?
Yeah. What's one aspect of pediatric care that AI would never be able to replace?
AI cannot show empathy to a crying mother. AI can't
Yeah.
give a crying mother a hug. AI
Yeah.
cannot help an anxious mother, cannot help a depressed mother. So
Yeah.
there is that personal touch, that human touch that AI
Mm,
can never replace. And that,
okay.
that gives clinicians like us some level of confidence that we're not going to become extinct.
You're not replaceable. Okay. Sweet or savory snacks for the kids? Which one do you pick?
Sweet, natural sweet, yes. Savory, savory often it's added salt, oftentimes.
Okay. What's the most surprising thing you've learned about food drug interactions in children?
What is the most surprising thing? I mentioned milk earlier, and the reason why I mentioned milk is that in the first 6 months of life, children are dependent on milk, whether
Mm,
formula or breast milk. And that time too happens to be a time where they are very vulnerable to illness. So you have to,
yeah.
and oftentimes a lot of bacterial infections that require antibiotics. So
Mm,
sometimes you have to strike a balance as to how to approach it because this is the only
mm,
thing this child can eat. But this same thing is interacting
yeah.
adversely with their drug.
Yeah.
So these are some of
Yeah.
the peculiarities. I mean, because if you're looking at a child that is more than 6 months that eats other things aside from milk, breast milk, and all
Mm,
that, you can always say, okay, just hold on with the milk for a week or five
yeah.
days.
Yeah.
But for a baby that is exclusively on milk, how long are you really going to hold on for? So these are some of the things that we, or that I personally have, challenges trying to balance.
Okay. Dr. Miriam, this conversation has been nothing short of enlightening. Thank you for playing rapid fire. Thank you for sharing your expertise, the passion, your vision for pediatric care with us today. It's clear that your dedication to delivering excellent patient-centered care and building efficient healthcare system is truly making a profound difference in the lives of children and their families. So we share Dr. Miriam's information in the notes. Before we wrap up, I want to highlight three key takeaways from today's discussion. Children's care are unique. Children are unique in their response to medications and nutrition. Their developing physiology means interactions can be more complex and require careful attention to dosing, administration, and diet. Number two, specific food drug interactions in pediatrics are crucial to understand, and that's from antibiotics like cipro and dairy milk to seizure medications like carbamazepine and food consistency. Knowing these interactions can significantly impact treatment, effectiveness, and safety. Where can we, if we have listeners who want to see where you practice, where can they reach you?
Okay, so I practice with the Reddington Multi-Specialist Hospital, Victoria Island and Lekki. And you can
Okay.
also find me on LinkedIn as Miriam Yusuf Ogome. You can find me on um, Instagram as Funmi Ogome. And I'll be happy to connect with you.
Okay. We're going to share Dr. Miriam Gomez information in the show notes if you'd like to reach out to her if you have questions. You find this on pharmaplansystems.com/podcast/episodes for more details and to find these resources. So don't forget to follow us on social media for daily tips and updates. You can find us on Facebook, Instagram, Threads, TikTok, LinkedIn, MediMilSafe. Also subscribe on YouTube at PharmaPlan Systems, or you can connect with me personally on LinkedIn. Your engagement helps us spread this crucial information far and wide. Dr. Miriam, once again, a heartfelt thank you. It's been an absolute pleasure having you on today.
Thank you very much, ma'am.
And to all our listeners,
Sure.
thank you for tuning in to When Food Meets Medicine. So until next time, eat smart, your meds matter, and your body will love you for it. Thank you.
Thank you.